of your companies own or control a health insurance division? Raise your hand. Please keep your hand up if you also employ healthcare providers or own clinics, specialty pharmacies, or any other kind of medical practice or pharmacy. Please keep your hand up if you also own or control a pharmacy benefit manager. And please keep your hand up if you lead a publicly traded company at which you have a legal responsibility to maximize shareholder value. So we've established on the record that the largest health insurance companies are not just insurers. They are also medical providers and pharmacies, diagnosing and deciding treatment for patients. They are also PBMs, another form of middlemen managing drug benefits. They are increasingly controlling every aspect of our healthcare system.
That clip matters because what you just watched is the quiet part being admitted out loud. The biggest health insurance companies in America are not just insurance companies. They employ doctors. They own clinics. They own pharmacies. They control pharmacy benefit managers, the middlemen who decide which drugs you're allowed to get and how much you will pay for them. So let's stop being polite and using proper language to call this something that it's not. This is not insurance. This is a well-coordinated scam hiding in plain sight because the same corporations that decide whether your care is approved are also diagnosing you, deciding your treatment, dispensing your medication, and profiting at every step along the way. That is not oversight. That is total control, control of care, pricing, outcomes. And here's the part that makes this so dangerous. These companies are publicly traded, which means that their executives have a legal obligation to maximize shareholder profits. Your health is not the priority. Your doctor's judgment is not how things are decided. It is all about profits. So when your claim is denied and your medication suddenly is not covered, when prior authorization delays care, it's not a glitch and it's not incompetence. That is their business model. One entity controlling insurance, medical care, drug access, while being legally required to squeeze profit out of every decision. That's not actually a broken system. That's a rigged system. And once you see it, you realize this racket is perfectly designed. So perfect, it seems impenetrable. Follow the Broken Science Initiative for more. Our team has been looking at these problems for decades, and we know where the bodies are hidden, and we are doing our best to sound the alarm.